coming to the next video in developmental disturbances of tongue. So here we will be discussing about median rhomboid glossitis. So as with any other pathologies, first we will try to understand what this is from the name. So median means midline, the middle. Rhomboid is the shape, it is rhomboid in shape. Glossitis means there is inflammation. So there is inflammation of tongue in a rhomboid shape in the midline region. So that is median rhomboid glossitis. We also have two other names, that is central papillary atrophy of tongue and posterior lingual papillary atrophy. So from the other names we can understand there is complete papilla atrophy in that region, and also it is posterior and also in the midline region. It is central, that is midline region, and it is also posterior. Now we will try to understand how this is happening. How is the median rhomboid glossitis developing? So this is a diagram which we will be seeing in development of tongue. So the development of tongue occurs when there is fusion of the two lateral lingual swellings and the tuberculum impar. When the tuberculum impar does not fuse with the lateral swellings, then that area, when there is no fusion, that area will turn out to be a smooth erythematous area resulting in median rhomboid glossitis. In this region, there will be no papilla or no taste buds. Now I have written another name also which you can see here, that is posterior midline atrophic candidiasis. So why is this? It is also called as posterior midline atrophic candidiasis because of the recurrent occurrence of a chronic atrophic candidiasis. So I told that it is smooth erythematous area, but it is erythematous means something reddish in color. But here it is not always reddish in color because most of the times there can be candidal growth. So when there is candidal growth, it will be white in color due to the excess keratin production. So in that cases, it is also called as posterior midline atrophic candidiasis. Now coming to the clinical features. Coming to the shape, we know it is rhomboid shape. Now coming to the size, it is every time less than 2 cm in size in greatest dimension. It is every time less than 2 cm. No cases have been reported more than 2 cm in greatest dimension. And it will be having a flat surface. It will be a smooth flat surface. Now coming to gender, it is mostly in males in the ratio of 3:1. Location, it will be posterior and in the midline. This will be every time anterior to the, so we know circumvallate papillae will be in a V-shaped. In this V-shaped grouping, there will be presence of circumvallate papillae. This median rhomboid glossitis will be every time anterior to the circumvallate papillae. No cases have been reported till which is posterior to circumvallate papillae. So every time it is anterior to the circumvallate papillae. Now the direction which the median rhomboid glossitis extends will be in an anterior posterior direction. It will be not extending in a lateral direction, it will be extending in a anterior posterior direction. And even though this will initially start at a very early age, at the initial childhood age, it is mostly diagnosed during the middle age. And most of the cases, your rhomboid glossitis is with candidal infection. There will be growth of candidiasis and it will be most of the time white in color. Now something we can see is kissing lesion. So in this place we have to know the difference between kissing lesion and kissing disease. We have kissing disease which is infectious mononucleosis, whereas kissing lesion is related to median rhomboid glossitis. So just know that here it is kissing lesion and not disease. So kissing lesion means, so imagine this is your tongue, the dorsal surface of the tongue. So here posteriorly you will have your erythematous, the median glossitis area. Now above you will be having your soft palate. So due to the constant contact of your tongue with your palate, Due to the constant contact, even your palate can also have a same erythematous area. So, it is called as kissing lesion. It's called as kissing lesion because of the constant contact between your tongue and your palate. Now coming to differential diagnosis. So some of the differential diagnoses are gamma of tertiary syphilis, granuloma of tuberculosis, and deep fungal infections, and granular cell tumor. And most of the time here in median Rhomboid glossitis, biopsy is not needed because mostly it is diagnosed clinically. Now coming to the histology. So in histology, what you can see is it will be something like this. The retapex will be bulbous. The stratified squamous epithelium will be atrophied. There will be no papillae. We can see many inflammatory cells infiltration. There will be dilated capillaries, and we can also see there will be excess keratin when there is candida infection. In case of candida infection, the retape process will be getting elongated. There will be excess keratin production, and there we can see keratin pearls. We can see keratin pearls also. Now coming to the treatment, there is no specific treatment needed. However, when there is candida infections, we can go for antifungal therapy, and there has been cases which have been completely subsided just with antifungal therapy. So that's all about median rhomboid glossitis. See you again in another video with another topic. Thank you.